you don't really need IV therapy.
I don't want to be advocating for everyone to have IV therapy when they are eating well and they are living well and exercising.
IV drips are trending all over TikTok and social media right now. But is it a fad or is there any real science behind it? Let's check this out. Welcome to Daily Dose with Dr. Tanya. We're going to talk everything about health, wellness, beauty, and things between. As a doctor, as a mother, and an entrepreneur who is a founder of a skin brand, I have a lot to share and talk to you. Each week, we will look into certain topics and we will discuss in-depth, honest discussions with the leading experts and gain practical steps and tips so that you can live well, age well, and be happy and glow from within. So from skincare to self-care, from hormones to hustle, this is your space where we will have real conversation, real results for real people. So let's get started. IV therapy has become a trend on all over the social media simply because few things. One is celebrities are getting it. And when they're getting it, they're putting it out there on their social media, the before and afters and, what benefits they have and all that. So it's all over the social media because celebrities using this, number one. Number two, all the information about it, statistics, it's, how it works, the evidence, it's there. It's available right in your fingertips. And thirdly, it's a lot more affordable and it is accessible for everyone. So these are the three reasons I think it is very popular these days.
So is it a fad or is there credible science behind IVs?
Okay. It's not a fad. There's definitely science behind it. And we know, as a doctor, I can tell you, we know for a long, long time, we have been traditionally using IV therapies like iron infusions, one of the classic example. And then at different interval, different other supplementation, like even vitamin C has been used for like many, many years, like decades. So it is definitely not fad. There's definite science behind it. What is important is patient selection. Who are the candidates who would be the right fit to get the IV nutrition? That is where the clinical judgment applies, and that's going to make the difference. I love the question. And as a doctor, I can tell you this very clearly. People think that IV therapy is some sort of like a beauty trick that you go to salon, get your IV drip, and then boom, your skin's going to glow and you're going to have like full energy, etc., etc. And that is wrong. This is serious medical therapy. If you are going to inject IV nutrients through your veins, it has to be properly considered as a medical treatment, and you need to see the right expert, the doctor, to make sure that you are the right candidate, as well as what medication and what dose are given into you. So that is one of the biggest misconceptions, that you go to a salon, you get your IV therapy and your skin will glow. Number two is a frequency of it. And it is not like a one-stop thing. You go get it and then job done. This requires consistency and commitment and regular intervals. So it's not like one therapy, one session and things magically get better. No, this is about consistent treatment in a prescribed regime to get the desired outcome. I hope that's clear. Love that question. And I can tell you as a doctor. Okay. So I may not be very popular if I say this, but I'm going to say this, okay? You're taking oral pills, and you're expecting the same results as your IV therapy. What you don't know is that you are going to pass majority of this in your urine. So your urine becomes an expensive urine. You're not getting enough of that nutrients into your body. Whereas the IV therapy, the difference is directly going to your bloodstream, directly into your system. So obviously the availability of these clinical nutrients are much higher. So that's the difference, the main difference. But I do understand a lot of people have got hesitation to have treatment through the veins. I get it. So in those circumstances, and you still want to get the benefit of the nutrients, then yes, taking oral supplementation consistently on a regular basis will surely get you results. Okay, the most commonly given, of course, iron infusion, everybody knows, and Infusions one. Vitamin C, oh, I love it. And that's a very commonly used. And thirdly, vitamin B, the B40, the multivitamin, that's actually very popular as well. Of course, all these things depends on clinical conditions, clinical problem. What are you going to solve? So that's very important. When a client comes, a patient comes, you're assessing the person and you're looking at what problem are you going to solve for the patient. And depending on what problems you're going to solve for the patient, then you choose your clinical nutrient. So it's not like someone walks in, one thing for everybody. It doesn't work like that. So you got to choose based on what the patient's after, what problem you're going to solve with the patient, for the patient, and what is the frequency. And of course, affordability comes to play as well. Of course, I love IV clinical nutrients when people with chronic conditions use it, because it's not actually treating the conditions through IV nutrients at all. Don't get me wrong. That's not what I'm saying. What I mean is, because of chronic conditions, their food intake and the nutrition intake reduces, and hence they're more tired, their quality of life reduces. But in those circumstances, when they have the IV nutrients, they obviously will notice a bit more energy, and they feel better. The inflammation that the body was going through because a result of the chronic condition, that changes. So because of that, the outcome is better. Risk and side effects. Okay. There are certain nutrients, so when patients get it through their veins, it causes uncomfortable side effects like nausea, giddiness, tummy pain, and it can become unbearable. But mind you, these are not a long-term problem. This is like a short-term when they're getting it, and that passes. So as long as the patients warned about it and they understand, that should be fine. Now, the side effects, I like to reword it. It's all about selecting your patient. Meaning to say, what medical conditions they have. They got any chronic problems, their kidney status, other chronic diseases they may have that could affect with the nutrients management, what medications they have. So all these things come to play. So it is not necessarily the side effects. It is more so when you give the clinical nutrients, how is their body going to react based on all the medical issues they have. Number two, what medications that they are on that could interfere with this clinical nutrients. So that's what matters mainly. So I think that's more relevant than actually me discussing about side effects. What are you trying to solve here? Okay. Or what is that you want to, what outcome you want to get? So that's important. So clinical nutrients is such a thing that is very popular. And why it is popular is because in day-to-day life, when they're so busy, like as moms and, like CEOs and like teachers, and they're really busy. So they are not able to look after themselves. Their focus goes down. Their skin gets dull. The hair fall happens, and all these problems in the busy lifestyle that we have. And that is where clinical nutrients becomes very handy and very popular for those sort of highly high busy kind of people. So for them, it works in a beautiful way because it helps them to regain their focus, restore the immunity, all of those things. It can be beneficial. Now, where it become tricky is when you're sick, it depends on what medical issues and things like that. And what the clinical nutrients, where it is relevant is it should help and it should support the treatment, but not an alternate. So it's not instead of the medical treatment that they're getting. This is a support to the medical medication or medical treatment that they're getting. So that's why it's called integrated, where it's together, not separate. So answering to the question, going back to the question, is it something that you get only for when you're sick? The answer is no. You can get it when you're well, and depends on what problems that you want to address and solve and what results you want to get. And can you get when you're sick? You can, making sure that you're not substituting the medical therapy, medical medication that's being prescribed by a doctor. This is just supporting it. I hope that's clear. Benefits of IV in general wellness. Look, I'm wearing a doctor's hat firmly now, okay? The difference is where what you need and what you want. So the need and want difference is there. So if you're fit and well, you eat well, you exercise regularly, you sleep well, you don't need clinical IV nutrition for you to live a good quality life, right? But on the other hand, you don't eat well, your sleep is deprived, you're at high stress job, you've got a lot of things going wrong, then you need the support, and that's different. But if you're completely well and you still want the IV nutrient, that's fine. You can go for it. It's fine. There's nothing, it's not contraindicated. It's fine. As long as you meet the clinical criteria of getting IV nutrition, you can definitely get it. But it's not, if you are sick, that's a different story. So in a well person, the difference is the need and the want. So I'll give you an example, like vitamin C infusion is super popular. And there you would see a lot of people with chronic medical conditions get it. And in history as well, there have been like doctors like decades ago, when there have been like outbreak of infections, vitamin C was given, and that's proved to help the quality of life and also improve the outcome better. So vitamin C is not actually an antibiotic or anything. The way it works, it reduces the inflammation that diseases causes to your body. So when you have a disease, your inflammation is all up. Okay. And then because of that, because of the inflammation, you are tired, you're fatigued, you have all this negative, you're drained, the energy goes down and everything because of the inflammation, because of the problem of the infection that you have. So the vitamin C reduces that. It's not fighting the actual virus. Hope that makes sense. It's not fighting the virus, not an antibiotic, but it reduces this. So when that happens, the patient obviously feels better. The quality of life improves. He can eat food better. He can engage in therapy better. So the role is there. But that's why I keep saying it's not substituting the mainstream management of anything. And this has to be always integrated and discussed with the treating doctor. Yeah, where I think there's great value and I've seen the results and I was really happy with it is the area where there's older women, older people, elderly population, where their clinical nutrition really helps them to get better in their like physical activities or their general well-being really boost up. And the fact is really simple. Their diet intake is poor. They can't probably swallow food properly. They're not getting enough nutrients on a day-to-day basis through food. In those circumstances, I have found giving them clinical nutrients is really a great outcome. So obviously, we need to keep in mind the medication and the medical history and all that. But I can see that after the therapy, their energy is better. Their quality of life has improved. So this is actually adding on, not substituting the medical therapy they're getting, but it kind of supports by giving them the nutrients to improve the quality of life. And that's where I find the role of clinical nutrients at its best. If you're someone who you want to get your IV nutrition and you're considering, what you need to first do is find out where you're going and check whether they are certified, they're qualified, and they know what they're talking about. That's so important because you need to know what you're getting, who is giving it to you, and the place need to be certified. So that's really important, top of the list. And you go there, you find out from them whether they are checking your medical background, your medication. So those things are very important because it's not about, one recipe for everything, and for everyone. They need to look at you, your medication, your medical history, and then prescribe the right nutrients that will be suitable for you and the right combination, the right mix. And after that, if there's any nutrition that you're going to get that has, or they may have like nausea as a side effect, hopefully you would be, given information about it. And then once that's all over, they should keep you under observation. And when the session is over, you go home. I would expect a phone call from them to make sure everything is okay with you, and a follow-up plan. So there's no like one session, forget about it. The follow-up is also equally important. Yeah. So that's what I would do if I were you. As a doctor, I can tell you what is very important in this whole process is patient selection. So that's why I can't emphasize to you enough that it is important that you go to the right medical expert who will consider you as a whole with your medical conditions, with your lifestyle and your desired outcome, and then formulate a treatment plan, an outcome plan, and then follow this up constantly. So this together as a whole is very important for you to get your desired outcome. Future of IV nutrients, I think it's looking very strong, very good. Mainly because the information is out there. There's been a lot more studies that's happened, especially in the last few years, and the awareness is at its peak. So, the future is looking really good. And also people understand why they're getting it, and and a lot more of them now understand it's not an alternate method to alternate therapy to a medical problem treatment. It is about integrating it into their existing medication and existing medical plan. So all of that together, when there is a harmony and integration between the clinical nutrients and the modern medicine practice, I think the future is looking bright for clinical nutrients.